First Five San Diego was created with the mission to support the health and well-being of the county's youngest children. They have historically been funded by tobacco taxes, but that's been going down recently. So they're dealing with less funding, but also a rise in the need for services.
COVID numbers aren't even necessarily the main contributor of that. And so we just know that the need is continually going up for children and youth mental and behavioral health services. And yet at the same time, we know that we are facing a funding cliff.
Erin Hogaboom is with San Diego for Every Child, a coalition of organizations focused on tackling child poverty in San Diego.
Proposition 1 is something that we've been following and watching very carefully.
She says youth and children advocates fear Proposition 1 could take funding from mental health support for kids.
We really are serious about addressing mental and behavioral health needs across our county. We can't only focus on some of the most visible and some of the and within the adult population. We have to be thinking further upstream. We have to be thinking about, the experiences that children and youth are going through now.
Proposition 1 gives counties some flexibility on how they can spend the money, but it's supposed to focus mostly on helping and housing homeless adults.
We're nowhere close to meeting the needs of our kids and families on many levels. One is the availability of services, the payment of services, and the availability of providers. We have half the number of mental health professionals we need.
Dr. Pradeep Gadwani is a pediatrician with the San Diego American Academy of Pediatrics. He says the number of children and youth dealing with behavioral and mental health needs has grown.
I appreciate that all of us want to help those folks who are homeless. We want to be safe on our streets. But if we don't start early and if we don't get those investments in place and be consistent with it, we're going to be paying for this in much greater ways. Can you imagine if we had invested in children's and youth mental health 20 years ago? Would we have the current homelessness problem?
He thinks Proposition 1 has noble intentions, but the execution of it could come at a cost for others. Tania Thorne, KPBS News.